How does Ziprasidone, Geodon, compare to other antipsychotics? If you are curious about how Ziprasidone, also known as Geodon, stacks up against other antipsychotic medications, you are in the right place. Let's break down the details to give you a clearer picture. Ziprasidone is classified as a second-generation or atypical antipsychotic primarily used for treating schizophrenia. It works by adjusting the levels of dopamine and serotonin in the brain. This adjustment helps alleviate symptoms such as hallucinations, delusions, and disorganized thoughts. When we look at how Ziprasidone functions, it acts as an antagonist at dopamine D2 and serotonin 5-HT2A receptors. This dual action is typical among atypical antipsychotics. However, Ziprasidone has a stronger affinity for serotonin receptors compared to dopamine receptors. This may help with mood symptoms and reduce motor side effects, which is a common concern with some antipsychotics. Now, let's compare Ziprasidone with other medications in the same category. For example, Olanzapine and Quetiapine have a lower ratio of serotonin to dopamine receptor affinity. This means they often come with more side effects, including weight gain and sedation, due to their higher affinity for histamine H1 receptors. On the other hand, Risperidone is also effective for schizophrenia but has a higher risk of causing extrapyramidal side effects, which include stiffness and tremors. This is due to its stronger blockade of dopamine receptors. Another medication to consider is aripiprazole. It operates differently as a partial agonist at dopamine D2 and serotonin 5-HT1A receptors. While it tends to have fewer side effects related to weight gain, it may cause restlessness, known as akathisia. In terms of side effects, Ziprasidone generally has a favorable profile compared to some other atypical antipsychotics. It is less likely to cause weight gain or sedation and does not significantly alter prolactin levels. However, it may lead to QT interval prolongation, which poses a concern for heart health. When treating schizophrenia, Ziprasidone effectively manages both positive symptoms, like hallucinations, and negative symptoms, such as lack of motivation. Its ability to balance mood while minimizing motor side effects makes it a suitable choice for many patients. However, the selection of an antipsychotic often depends on individual patient needs, including specific symptoms and potential side effects. Overall, Ziprasidone offers a unique combination of effectiveness and tolerability, making it a strong option in the treatment of schizophrenia, especially for those needing mood stabilization without a high risk of motor side effects.